Prescription medication dependence never starts as a drug problem. It starts as a solution, and it is, quietly, one of the most common dependencies in the world, cutting across every background, every level of function, every kind of life, which is exactly why it so rarely gets named for what it is. The people we see arrive from very different places. Someone who built a career, raised a family, never touched anything recreational in their life, and is now organizing their day around the sleeping pill their GP prescribed 3 years ago. Someone who partied hard in their 20s, got clean, considered that chapter closed, and didn't see the benzodiazepine coming. Someone who had surgery, managed their recovery responsibly, followed the instructions exactly, and 6 months later can't get through a morning without it. Someone who has always used substances to take the edge off, and somewhere along the way, the prescription became the most dangerous one in the drawer. Different histories, different roots in, and they share the following. The body adapted to a substance it was given. That is not a character failure. It's not a hidden weakness finally surfacing. It is a physiological consequence, and there is no version of that which requires embarrassment. Because it came from a doctor, it felt responsible, legitimate, and that is exactly why so many people only recognize what's happening after it's already running the show. From the outside, things still function, but privately, the day is being organized around the prescription. Sleep depends on it, calm depends on it, getting through depends on it. The gap between how things look and what is actually happening keeps widening, and the energy it takes to manage that gap is its own kind of exhaustion. The thing we hear most often: I'm not like the people who go to rehab. This was prescribed. That belief is usually genuine, and the body responds the same way regardless. Medication has a place. What we offer is clarity, the proper clinical oversight, and the privacy to address this without it becoming the thing that defines you.
It started as the responsible thing, managing the pressure, protecting the performance. At some point, the prescription became the architecture, and everything else was built around it. We begin with the clinical facts: how long the dependency has been building, how deeply the receptors have adapted to the presence of the substance, and what the body is actually doing when a dose is delayed. That last part matters more than people realize. What presents as anxiety or craving is often the nervous system in genuine physiological protest. Not weakness, not lack of resolve, but chemistry. Yet we ask the more important question: what is this medication actually masking? Anxiety, undiagnosed ADHD, the slow grind of burnout? That single question changes everything. We have often seen a stimulant dependency or a cocaine habit that defied explanation, which upon closer inspection revealed a lifetime of untreated ADHD. The substance was doing something real, compensating for a dopamine regulation system that had never worked the way it should. The brain found a solution. It was destructive, but it was not irrational. Our path forward is to treat the underlying reality, so the dependency eventually loses its reason to exist.
Two patterns appear most often. The first is performance. Stimulants like ADHD medication misuse. In people who discovered early, it made them more like the version of themselves the world expected. The second is recovery. Benzodiazepines, sleeping tablets, opioids, anti-anxiety medication, frequently combined with alcohol. Up to perform, down to recover. A cycle that runs for years before the person inside it recognizes it as a cycle at all. My role is to understand what is driving the use, stabilize the system, and decide carefully what needs to change. One important thing: certain medications, particularly benzodiazepines and opioids, require medical supervision to change safely. That is the clearest reason why this works best, with a clinical team alongside you every step. We treat medication with precision, the right amount for the right reason, under close clinical watch.
Lasting change is about more than reducing a dose. It's about changing the conditions that made the dose feel necessary in the first place. Many high performers have run for years at full output. No genuine recovery, no margin, no real off switch. The medication filled that gap. We work on what sits underneath: routines that protect sleep, boundaries that reduce unnecessary load, a rhythm the body can actually sustain. The pressure was always running the show. The medication just made it survivable. We address the pressure.
Medication addiction carries a particular kind of shame because it didn't start in a dark place. It started in a doctor's office. It was prescribed, monitored, sanctioned. And so the question that haunts people isn't just, how did I get here? It's, how do I ask for help without being seen as an addict when I was just following medical advice? That shame keeps people performing, hiding it, managing it just well enough that the conversation stays off the table, sometimes for years. But shame needs secrecy to survive. When you can finally name what's happening in the presence of someone who understands how you got here and isn't judging you for it, the grip begins to loosen. What most people don't realize is that medication dependency rarely exists in a vacuum. There was a reason the medication felt necessary, and often that reason has roots in unresolved trauma, chronic stress, chronic pain, or suffering that never had another outlet. The medication became the nervous system's way of coping with something it didn't have the resources to face. That's not weakness, that's adaptation. In therapy, we look at what the medication has been doing and what it's been helping you carry, face, or avoid, because the pressure that made it necessary is still there. Through body-based modalities like EMDR, IFS, and sensory motor psychotherapy, we address the underlying pain directly at the neurological level. When we do, the dependency loses its foundation. Step by step, you build internal steadiness that belongs to you. So the next time the pressure spikes, you have something of your own to reach for. And for those living with chronic pain, we also work with clinical hypnosis, both deeper work in session and self-hypnosis techniques you take with you. This gives you a way to manage your pain that's yours, on your terms, and it restores something medication dependency quietly takes away: agency.
The patients we see with prescription dependency, whether it's sleep medication, benzodiazepines, painkillers, they have usually been trying to solve it for years, reducing the dose, switching medication, pushing through. And what nobody told them is that the problem isn't just the medication, it's what the medication has done to the gut. There's a fact I share with almost every patient that generally surprised them. Around 90% of the body's serotonin is produced in the digestive system, not the brain. Mood, sleep, anxiety, pain tolerance, these are gut functions as much as they are brain functions. And prolonged medication use disrupts the system deeply, compromising the gut lining, depleting the microbiome, impairing the body's ability to produce its own neurotransmitters. So restoring the gut isn't a side note, it's essential in its own right. But what's fascinating is that it also determines how much a person can actually absorb from the psychological work. If the gut-brain axis is inflamed and depleted, the nervous system is in a chronic stress state, and you cannot do deep therapeutic work from inside a chronic stress state. The body won't allow it. At Paracelsus Recovery, we supervise the detox medically, and alongside that, we are rebuilding the internal environment, the microbiome, the gut lining. The nutrients that sustain pharmaceutical use quietly depletes, like magnesium, B vitamins, omega-3s. When the body starts producing its own calm again, the psychological work doesn't just become possible, it becomes something the patient can actually hold on to.
When the system has relied on medication to settle, the body needs to relearn how to downshift on its own. For high performers, stillness can feel like losing ground. Part of this work involves learning to sit with that stillness, not to override it, but to use it. In a safe environment with support, stillness becomes a tool rather than a threat, a way of listening to what the underlying need actually is, beneath the reach for the substance. Short, repeatable tools, breath pacing, grounding, orienting, reduce arousal, and work with who you are, not against it. Practiced where you actually need them, before sleep, after stress, on travel days. Over time, the nervous system discovers something it may have forgotten. That calm is available from the inside, generated, not prescribed.
The work doesn't end when you leave, it evolves. Your same team stays connected, reviewing your sleep, focus and mood, refining what's needed as life resumes. This continuity is part of the medicine, a living bridge between treatment and real life. Evenings are where most patterns live and where they begin to change. Each client works with a live-in therapist matched carefully to temperament and goals. You are supported by more than 15 specialists, physicians, therapists, and experts, all sharing one record, one plan, and daily communication. Switzerland is not just a location, it's an active ingredient in your recovery. This country holds a centuries-old memory of health and sanctuary. We're not just a clinic, we are part of a long tradition of restoration. There is a reason the world comes here to heal. When you arrive in Zurich, you step into a culture that values privacy and precision above all else. In a standard medical setting, the environment often works against you. It's sterile, noisy, and unfamiliar. That creates a specific kind of stress. For a high-functioning individual, a drop in your standard of living creates distraction. If you're worrying about your comfort or fighting the logistics of your stay, you're not focused on your health. That is unnecessary noise. We view comfort as a clinical necessity. We deliver our care in a private residence and partner with the Dolder Grand Spa, the best Switzerland has to offer. We know that psychological resistance is a vital diagnostic tool. It tells us where the work needs to be done. But we want to ensure that the only resistance you feel is the one that matters, the internal one. We remove every ounce of external friction, from the texture of the room to the seamlessness of the service, so that nothing stands between you and the clinical work.
We are the connective brain between your results and your plate. With our dietitians and chefs, we design a culinary healing experience you actually enjoy. Timing meals, balancing glucose, reducing inflammation, so you feel good while you eat and still feel good after.
The experience is end-to-end. We organize private aviation and meet you on the tarmac. A Bentley transfer brings you directly to the door. You do not touch a bag. You do not navigate a terminal. Our team acts as the defenders of your time. We handle the logistics, the security, and the details invisibly. If you're still functioning, still delivering, but your days are being managed by a prescription you no longer feel in charge of, you are carrying more than one nervous system should carry alone. And the fact that it started as something a doctor approved, something that felt responsible, that is exactly why this is so easy to miss and so worth addressing properly. Pain is universal. Recovery is personal. We build yours around you. Speak privately with the lead physician today.